Hey everybody, it's Dr. Andrews with Optometric Associates. Just wanted to kind of talk to you about some of the different in-office procedures that we have available for eye or ocular emergencies. One common one that we see fairly frequently is foreign body, something stuck in the eye, something foreign to the eye. Could be metal, could be organic. Hey, those things happen. If it's metal, we have different tools and things that we can actually drill out the piece of metal, get rid of any kind of rust or oxidizing that's occurring to the ocular surface before further infection were to occur. Another common one is something stuck up underneath the eye. That's typically some kind of piece of wood or something from using a saw, and that can actually really be uncomfortable. So we all offer those services at our office. Corneal abrasions are something that's common. It can be from something stuck in the eye or just something that slid by your eye, like a child's finger or a piece of paper at work. They can also be very, very uncomfortable. So somebody with a corneal abrasion typically is coming in holding their eyes shut, wearing sunglasses. We actually can repair the epithelium in our office and apply something that's FDA approved for corneal abrasions, like a bandage contact lens that would help make that skin underneath heal much quicker. And we offer that service in our office, as well as prescription of any kind of pharmaceutical agents that may be necessary for making sure that you don't become infected from that open wound on the surface of your eye. Chemical burn testing. If you had a chemical reagent come into your eye and it's slowly burning your eye, it could be acidic, it could be basic. We have pH testing at our office. We want to make sure we know what it is, acidic or basic. Make sure that chemical burn is treated. Before you leave the office, make sure the pH of the ocular surface is totally neutral, and repair any kind of damage to the epithelium or any tissue around the eye that could have been damaged from that extensive chemical burn. We do all that in-house. Any kind of conjunctivitis testing. So, pink eye, red eye, what is it? Is it bacterial, viral, fungal? We have all kinds of tests at our office. One in particular that can determine, is this a viral conjunctivitis or not? Is it associated with a virus? Virus type of pink eye, viral conjunctivitis are highly contagious. So if that was the case, we would want you to self-isolate then after that incident. Get you some pharmaceutical agents to try to reduce the amount of eye redness that you're having, but also the amount of contagiousness that you have, and to try not to pass it on to families and friends. That's something we do all the time at our office for eye emergencies. Prokeras or certain type of contact lens. It's Prokera amniotic therapy. We use this. We have these lenses on file all the time at our office in a deep freezer, stored at minus 80 degrees Celsius. These lenses are used for extensive corneal damage, corneas that might need repaired very quickly, such as after a chemical burn. Somebody who's had extensive scar tissue formation, possibly from an abrasion or an active infection, we can use these on. So that's excellent, awesome technology that we have at our fingertips at all times, 24 hours a day if we need it. Flashes and floaters, that's a very common one. Somebody might call and say, hey, I see some new flashes, some new floaters in my vision. I want to make sure I didn't have a retinal tear, a retinal hole, or more importantly, a retinal detachment. We have all kinds of eye drops to get your eyes dilated, and that can evaluate you if there is a retinal tear or hole, and we find it on the weekend or an evening or some kind of emergency type timeline. We have retinal physicians on call at our office all the time. If we need to get you in to have a retinal tear evaluated, a retinal hole repaired, or even a detachment, we can get you in with these doctors within 24 to 48 hours. It's very nice. We have great relationships with all of our retinal physicians in the area. Any kind of diplopia or double vision testing we have at our office. So if you have new onset diplopia or double vision and you're just not seeing things right, all of a sudden you see two images, you're in a car accident, you have some kind of trauma to your head, and now you're seeing double vision, that's a problem. So we offer sensory motor examinations at our office. Is a type of specialty eye exam that we look for different kind of eye muscle imbalances or eye muscle issues. And if we need to, we can order kind of very fast neuroimaging or urgent neuroimaging to see what muscle or what nerve might be affected within the brain or skull. That includes testing for droopy eyelids. So if you have a new drooping eyelid or something like that, obviously that's wrong. Something's wrong. Come in, we'll do a sensory motor examination. If we need neuroimaging, we can get that very quickly right at our fingertips. If you ever have a blunt force injury, something hits your eye, and all of a sudden the vision starts to go gray or dark, obviously we would want to evaluate you very soon for a retinal issue, but also to rule out any kind of bleeding in the front surface of the eye. And if there is bleeding inside the eye or somewhere within the eye, vision will also go black or dark. So that's something that we can offer evaluation for. If there's pharmaceutical agents that can help slow or stop the bleeding, that we would prescribe to you right that same day and get it to a 24-hour pharmacy right at our fingertips as well. We would want to also make sure that there's no retinal detachments as the retina clears. So, we can obviously order all that through our office. Basically, if you have any kind of eyelid lacerations, obviously anything too large, you need to go to ER urgent care for stitches, but mild cuts or abrasions around the eye, we do have ways to fix that within office treatments like Tegaderm. We also have a glue called Thermobond that helps to seal down any kind of new wounds that are within or around the eyes to stop the bleeding. And basically, we have a number of other services for urgent care. But that just kind of highlights the few. So if you have any of these things and you want to be seen and evaluated, our excellent, talented doctors at our office will be able to do that for you and get you in. Obviously, safety glasses can help a lot of these things from happening. So please wear those if you're working around things that you need to wear safety glasses for. But also, if an injury does happen, we're here for you. If it's on the weekend, we're here for you. Give us a buzz. One of our doctors will be in touch with you within an hour or so of your call. And, we appreciate you watching this video. Thanks for checking us out online. And hopefully someday we can meet for a regular healthy eye exam, not necessarily urgent eye care exam. But if you do need urgent care, we're here for you. All right. So Dr. Andrews, thanks for watching this video, folks, and signing off till next time. Bye-bye.